Hello, hello. Can say something? We want to test the sound. Can you hear?
Can hear everyone?
Yes.
Yeah,
Okay.
yeah.
Thank
Okay.
you.
Hello, can everybody hear me? If yes, can give me a thumbs up. Thank you. All right, thank you for responding. Okay, so now it's 2 o'clock already, so we will start our health talk soon. Okay, so my name is Madeline, a well-being coordinator from SGH Community Nursing. Today, I will be your host for your talk today. Okay, so today we have our SGH, talk from SGH pharmacies. So today the topic is about eating and medication. Know the rules to avoid food drug clashes. Okay, we hope you find this session useful. If you have any questions, please feel free to raise them during the Q&A session at the end of the talk. Alright，大家下午好，感谢大家今天参加我们的健康讲座。所以我是 Madeline，来自新加坡中央医院社区护理团队的乐活协调员。今天我是你们的主持人。所以今天的讲座呢，是由我们 SGH 来的。他们的今天的讲座的主题是吃饭吃药有学问，还有避免食物药物的冲突。希望大家的内容会大家对有所帮助。如果有什么疑问的话，请等到讲座结束后的问答环节来提问。谢谢大家，请我们欢迎我们的今天的演讲者 Miss Sherlyn 来。
Hi, sorry, maybe you put on the mask, right? So our side is very soft.
Hold on 啊。
Everyone can hear me now?
Can hear and can see your slides.
Okay, great. Hi everyone, I'm Shirley from the Division of Pharmacy at Singapore General Hospital. Today we'll go through the rules to avoid food drug clashes. So many drugs can be administered orally in various forms such as liquids, capsule, tablets, or chewable tablets. Oral administration is the most commonly used method because it is convenient, safe, and cost-effective. However, the presence of food or other medication in the digestive tract can affect how quickly and how well drugs are absorbed. Therefore, proper timing of oral medication administration is important to ensure optimal effectiveness. Some medications are administered sublingually, meaning under the tongue, or buccally between the gums and cheeks. These routes allow the drug to be absorbed directly into bloodstreams, bypassing the intestinal wall and liver, resulting in rapid onset of action. A common example is nitroglycerin GTN tablets or spray used to relieve angina. So when taking medications, it is important to follow the proper way. Always take your medication as prescribed. Before taking any medication, check that it's the correct drug name, patient name, and instructions. Medicine should be stored in a cool, dry place, away from heat, sunlight, and moisture. Do not place different medications into the same container, as this may cause confusion or affect the medication's quality. It is also important to inform your doctor or pharmacist if you are taking other medications, health supplements, or nutritional supplements, as these may interact with your prescribed medication. If you experience any of the side effects or unusual symptoms after taking your medication, please inform your doctor or pharmacist immediately. The timing of the medication administration is important to ensure the medication works properly. Before and after meals, refer to taking medications about 30 to 60 minutes before eating and 30 to 60 minutes after eating. Fasting refers to taking medications 30 to 60 minutes before eating or 2 hours after eating. Before bedtime means taking the medication 30 to 60 minutes before going to bedtime. So let's begin with our first case, Mr. Lim. He's a 75-year-old gentleman. Here is the current medication regime for Mr. Lim. First, for cholesterol management, Mr. Lim takes atorvastatin. To manage his blood pressure, Mr. Lim is on 2 medications. He takes long-acting nifedipine and losartan. He is also taking omeprazole for gastric protection and aspirin for blood thinning. Finally, Mr. Lim is prescribed metformin to lower blood pressure. So, Mr. Lim had a concern. I have been taking my medications for years. Can I stop taking them? Most of the medication's dosage is individualized, especially for chronic conditions such as high blood pressure, high cholesterol, and diabetes. Normal levels are maintained only with regular medication. If medications that lower blood pressure, cholesterol, or blood sugar are stopped, their effects will disappear and these levels may rise again. Therefore, patients should always consult their doctors before stopping any of the medications. Mr. Lee made a further inquiry regarding his blood pressure medications. My blood pressure is normal. Why do I take 2 blood pressure medications? So that is a common question from our patients. We can see from the table that Mr. Lim is taking 2 medications to lower high blood pressure. Those are highlighted in yellow. The first one is nifedipine, the other one is losartan. So before we answer Mr. Lim, we need to understand what is hypertension or high blood pressure is. Pressure has 2 numbers. The top number, called systolic pressure, is the pressure when your heart beats. The bottom number, called diastolic pressure, is the pressure when your heart relaxes between beats. Hypertension is diagnosed when blood pressure readings are taken on 2 different days and the readings are 140 over 90 or higher. High blood pressure often has no symptoms and is called silent killer, but controlling it helps prevent heart attacks, strokes, and kidney problems. So how high pressure can often be prevented with healthy lifestyle choices. So try to limit your salt intake to less than 5 grams a day. Eat more fresh vegetables and fruits and reduce foods high in saturated fat. If you smoke, quitting is important as well. Alcohol intake should be also reduced. Finally, regular exercise helps to keep your blood pressure under control and improves overall heart health.
Hi, sorry, Shirley.
Yeah,
Elizabeth here.
okay,
I've got audience requesting you to speak a little bit softer, and also later you'll be speaking in Mandarin, right?
that's right.
Okay, cool. Thank you very much.
Okay, sure. Your blood pressure may look normal now because you're taking your medication regularly. Sometimes one blood pressure machine is not enough to control blood pressure. In that case, adding another medication helps to lower it more effectively. Combination works better because each medicine acts differently. This also allows a lower dosage of each drug, which helps reduce side effects. Let's move on to our second case. The patient is an 86-year-old lady, Madam Huang. Her current medications are as follow: simvastatin for cholesterol, amitriptyline for mood, iron polymaltose for iron deficiency, lactulose syrup for constipation if needed, alendronic acid for osteoporosis, and omeprazole 20 mg for gastric protection. Madam Huang asks why she must take cholesterol medication at night and whether she can eat in the morning the way Uncle Lin does. So let's take a look at statins, the most commonly prescribed medication to control LDL, or we call it in layman term, bad cholesterol. By lowering LDL, they help prevent heart disease and stroke, reduce overall mortality, and are widely considered both safe and efficient. Because the body produces cholesterol mainly at night, short-acting statins work best when taken at bedtime. However, newer statins such as rosuvastatin and atorvastatin last longer in the system, so they can be taken at any time of the day with equal effectiveness. Moving on, let's address a common concern directly. Can long-term statin use harm the liver or kidneys? Based on the current medical evidence, the truth is reassuring. Several major clinical trials and scientific findings have concluded that there is no evidence that statins are significant cause of liver failure or chronic kidney disease. Serious organ damage from this cholesterol-lowering medication is rare. For most people, the well-established benefits of statin in preventing heart attack and stroke far outweigh these minimal risks. Madam Huang then asks, I take many medications and sometimes get heart stools. Is this normal? Why must iron be taken on an empty stomach? So iron supplements are important because it provides the iron your body needs to make healthy red blood cells and carry oxygen. For better absorption, it's ideal to take it on an empty stomach about half an hour to 1 hour or 2 hours after meal. If it upsets your stomach, taking it with a little food is okay. You can boost its effectiveness by taking with a small glass of orange juice, as the vitamin C helps absorption. However, avoid taking it with coffee, milk, calcium supplements, or stomach medications like antacids, as they can block the iron. Don't be alarmed if you notice your stool have turned black. This is a normal and harmless side effect. If the iron causes constipation, trying to increase your daily fiber and water intake. Now she has another concern. Is my constipation caused by my medication? Several drugs can contribute to constipation, and the patient should monitor for this side effect. This includes certain antidepressants such as fluoxetine, mirtazapine, and amitriptyline, sedative or antipsychotic medication like quetiapine, olanzapine, and clozapine, diuretics such as furosemide, and some blood pressure medication including diltiazem and verapamil that can slow bowel movement, iron supplements such as ferrous sulfate, and antacids like malanta and gaviscon may also reduce bowel motility or harden stool. In addition, opioid analgesics such as codeine and tramadol are well known to cause constipation, so preventive measures such as adequate fluid intake, dietary fiber, and early use of laxative when appropriate should be considered. To prevent or manage constipation, patients should maintain adequate water and fiber intake by consuming vegetables, fruits, juices, and whole grain or coarse bread. Good bowel habits are important, including responding promptly to the urge to pass stool and establishing a routine with 15 to 20 minutes after breakfast being the best time to go to the toilet due to the natural bowel activity. Regular exercise is encouraged as it strengthens the stomach muscles and improves bowel movement. Long-term use of irritating laxatives such as senna should be avoided, while soft stool softeners like lactulose may be used when needed to help soften stools and ease bowel movement. So Madam Huang then asks, can I drink coffee? To answer Madam Huang's questions, let's see how coffee affects medication. Caffeine stimulates the nervous system, and while up to about 4 to 5 cups of coffee a day is generally considered safe for most people, drinking coffee together with certain medicine may reduce their effectiveness. For example, coffee can reduce the absorption of thyroid hormone medication, some antibiotics, vitamins such as B vitamins, and osteoporosis medication like alendronate, which should be taken with plain water on an empty stomach instead. Caffeine also has a diuretic effect, causing the body to lose more fluids, and it may worsen insomnia or reduce the effect of sleeping pills. To be safe, it is best to avoid taking medications together with coffee unless advised otherwise by a healthcare professionals. Last but not least, let's move on to our last case today, a 57-year-old gentleman, Uncle Chen. His current medications include warfarin as a blood thinner, metazapine for mood, gliclazide for diabetes, and paracetamol or Panadol to relieve pain when necessary. Uncle Chen asked a question when he visited a pharmacy. What should I know about diet while on warfarin? Uncle Chen is currently on warfarin, which is an anticoagulant that prevents blood clots from forming in the arteries, veins, or heart, and prevent existing blood clots from enlarging. The effectiveness of warfarin depends on vitamin K in the body and the food consumed. A sudden increase in vitamin K intake can reduce warfarin effectiveness and increase the risk of blood clots, while a sudden decrease can intensify the medicine effects and raise the risk of bleeding. It is a common misconception that vitamin K-rich food must be completely avoided. In fact, consuming consistently moderate amounts of this food is key to maintaining stable anticoagulation. So for this reason, Mr. Chen should consume approximately the same amount of vitamin K each day. It's important to know that certain herbs and supplements can affect warfarin's effectiveness. For example, coenzyme Q10, St. John wort, ginseng, and green vegetables can reduce warfarin effectiveness and lower the INR. On the other hand, ingredients such as ginkgo biloba, glucosamine plus chondroitin, and garlic, and as well as large amounts of ginger can increase INR and raise the risk of bleeding. This is why we should never take Chinese herbal medicine or any supplements alongside with the warfarin without consulting the doctors. Some combination can be very dangerous, so always check with your healthcare provider before adding anything new. When taking warfarin, it is also important to remain vigilant for any signs of bleeding, as the medication increases the bleeding risk. Seek immediate medical attention if you experience any of the following: unprovoked or severe bruising, pink or red urine, black tarry or bloody stools, bleeding gums, frequent nosebleeds, coughing up blood, or any bleeding that does not stop on its own. These symptoms may indicate that your blood is too thin and require prompt evaluation. Do not delay, contact your healthcare provider immediately. Uncle Chen and Mr. Lim drinks beer together at the coffee shop downstairs. Are there any conflicts with their drugs? So let's take a look again at Mr. Lim's medication and Uncle Chen's medication. So some of the medications such as metformin, gliclazide, warfarin, metazapine, paracetamol or Panadol, and aspirin can interact with alcohol. Alcohol can interfere with how your medication work by competing for the same enzyme in the liver that are responsible for breaking them down. This can slow down the metabolism of the drug, causing it to build up in the body and intensify its effect, which may lead to increased side effects or toxicity. Conversely, some medication can also block the breakdown of alcohol, leading to its accumulation in the bloodstream and resulting in adverse reactions such as nausea, headache, or flushing. Under normal condition, the liver releases glucose to maintain blood sugar levels. However, drinking alcohol occupies the liver with metabolizing the alcohol, preventing it from releasing enough glucose into the blood. Therefore, drinking an empty stomach can cause a drop in blood sugar. It usually takes about 1 to 1.5 hours for the liver to completely break down a serving of alcohol, during which time there is a risk of low blood sugar. In addition, frequent drinking can increase the triglyceride level, leading to high blood lipids and a greater risk of heart disease. Alcohol can also interfere with blood thinners such as warfarin and aspirin, which are essential for managing cardiovascular condition. Drinking alcohol increases the risk of internal bleeding and impairs the blood's ability to clot properly. It can also cause warfarin levels to fluctuate, making it more difficult to maintain a stable and effective dose. Paracetamol or Panadol competes with alcohol for the same metabolic enzyme, and excessive alcohol consumption can increase this enzyme's activity, leading to the breakdown of paracetamol into toxic substances. These toxic byproducts can damage liver cells and over time cause serious liver injury or even liver failure. Therefore, it is important to avoid taking Panadol while drinking alcohol to protect your liver and overall health. Taking mirtazapine together with alcohol can also increase side effects because both substances act on the central nervous system, leading to enhanced drowsiness and sedation. This combination can impair judgment, coordination, motor skills, and reaction time, making daily activities more unsafe, especially tasks that require alertness and concentration, such as driving. To ensure medicine are used safely, you should avoid sharing medicine with others, as each treatment is prescribed based on individual health conditions and needs. For safety reasons, Chinese and Western medication should not be taken together unless advised by a healthcare professional, as unwanted interactions may occur. Medicine should be taken with plain water rather than coffee, tea, milk, or soda, as these drinks may affect how medication works. Alcohol should also be reduced because it can harm the body, increases the side effects, and reduce treatment effectiveness. If you are unsure about a medication or combination, always consult a doctor or pharmacist for proper advice. Thank you. Now we will go through the Chinese version. 大家好，我是来自新加坡中央医院药剂部的药剂师，今天要和大家分享一个非常重要的主题：吃饭吃药有学问，避免食物药物冲突。了解这些内容可以帮助我们更安全、更有效的使用药物，减少副作用，也避免不必要的风险。首先，我们来看看最常见的用药方式——口服。口服用药是最安全、最方便，也是最容易被病患接受的方式。药物可以是液体、胶囊、片剂或咀嚼片，但口服用药也有一个重点：食物和其他药物会影响药物在肠道的吸收速度和吸收程度。由于药物要经过消化道，才会有它的作用。口服用药从口腔到胃就开始被吸收，然而大部分的药物通常从小肠吸收，药物穿过肠壁， 然后进到肝脏，之后通过血液转运至其部位。多数药物在小肠壁和肝脏都会发生化学结构的改变，或者我们叫做代谢，从而降低血液中的药物量。因此，服务时间非常重要。第二种是舌下或颊部吸收，这种方式不需要经过肠道或肝脏，药物能快速吸收到血液中，常用于紧急状况。最常见的例子就是缓解心绞痛的药，或者我们叫 GTN， 可以是舌下片或者是片剂。无论什么药物，我们都需要
Shirley,
Yes.
sorry, Elizabeth. Your slide is not moving.
Oh.
You're still at the thank you slide.
Can see now?
No, it's the thank you slide. Okay, 等一下。Okay, so it's a thank you slide. Your screen.
Hang on.
Mm-hmm.
Sorry, now can see?
Can see, but not the presenter. Oh, okay, can ready. 可以了。
可以，我需要重复吗？妹妹，我从第二个开始重复。
好的，
最好重复。
可以，没问题。
谢谢。
好，首先我们来看看最常用的用药方式是口服。口服用药是最安全、最方便，也是最容易被病患接受的方式。药物可以是液体、胶囊、片剂或咀嚼片，但口服用药有一个重点，食物和其他药物会影响药物在肠道的吸收速度和吸收程度。由于药物要经过消化道，所以口服用药从口腔和胃就开始被吸收。然而，大部分的药物通常从小肠吸收，药物通过肠壁进至肝脏，之后通过血流转运至其部位。多数药在小肠壁和肝脏就会发生化学结构的改变，或者我们叫代谢，从而降低血液中的药物量。因此，服药的时间非常重要。第二种是舌下或者颊部的吸收，这种方式不需要经过肠道或肝脏，药物能快速吸收到血液中，常用于紧急状况。最常见的例子就是缓解心绞痛的硝酸甘油，可以是舌下片或者是喷剂。无论什么药物，我们都要遵守以下规则：第一，按正确的时间服药；第二，服药前一定要确认药名、剂量和指示，以及是否给自己的药物；第三，药品需要存放在干燥阴凉处；第四，不要把不同的药物混合在一个容器里，以免出错；第五，如果有服用保健品，请务必要告诉医生或者药剂师。最后，若出现不适或副作用，一定要尽快求医。不同的药物有不同的最佳服用时间。饭前和饭后是指吃饭前和吃饭后约30至60分钟。空腹指的是饭前30至60分钟，或者饭后2小时。另外，睡前指的是就寝前30至60分钟。稍后我会在各个药物的章节中详细解释。接下来我们看看几个真实生活中常见的案例。林叔叔今年75岁，林叔叔现在在吃降胆固醇、高血压、保胃、降血糖和降凝血药。许多病患都会问， 我吃药吃了这么多年，我可以停吗？答案是不能自行停药。为什么不能随便停？因为药物剂量是医生根据您的身体状况量身定做的。血压、胆固醇、血糖看起来正常，很大原因是因为你有一直规律的服用药物。若想停药，一定要先让医生评估是否合适，才能逐步减量或者停药。高血压是目前全世界公认的引发脑中风的首要危险因素。血压越高，高血压持续的时间越长，脑中风发生的可能性就越高。很多患者往往在治疗期间感到症状减轻或者消失，就自作主张的断用药。其实这样的服药方法很不好，会造成血压忽高忽低，使血压长期得不到控制。除此之外，一旦暂停降血压、降胆固醇、血糖的药物，治疗作用消失，三高会再次提升。林叔叔问：我每天的血压量的都是正常的，为什么要服用两种血压药呢？这是另一个常见的问题。我们可以看到林叔叔现在在服用两种血压药，一个是尼非地宾，另一个是罗萨丹。在我们回答林叔叔之前，首先我们来探讨什么是高血压。血压是由两个数值组成，收缩压显示心脏收缩或者跳动的血管压力，舒张压显示心脏在两次跳动之间的舒张时的血管压力。如果在两个不同的日子测量血压，而2天的收缩压都高于或等于140，或2天的舒张压都高于或者等于90，即可诊断为高血压。它被称为沉默的杀手，因为很多人没有症状，却在悄悄伤害着心脏、脑部和肾脏。要预防高血压，我们可以减少盐分的摄取，多吃蔬果，避免高脂肪的食物，戒烟，减少饮酒。最重要的是规律运动。有些病患吃一种血压药效果不足，需要吃第二种药来加强效果。组合用药可以减少单一种药物的副作用，并更有效地降低血压。记住，血压正常有可能是因为您有在按时服药。接下来我们看看第二位患者黄奶奶，86岁。黄奶奶现在在服用胆固醇、抗抑郁、补血、便秘、骨骼疏松症和保胃药。黄奶奶有一个疑惑，为什么胆固醇药要在晚上吃啊？可以跟林叔叔一样在早上吃吗？这是关于胆固醇药物常见的疑问。他汀类药物是最常见降低坏胆固醇，或者我们叫 LDL 的药物，能够预防心脏病和中风。人体的胆固醇主要在晚上合成，所以某些他汀药物，例如 simvastatin、lovastatin，睡前吃最有效。但像比较新的他汀类药物，例如 rosuvastatin、atorvastatin，它的作用时间较长，任何时候服用都可以。很多人担心他汀类药物会伤害肾脏。根据大量的研究，没有证据显示他汀类药物会造成严重的肝或者肾衰竭。绝大部分的用患吃这些药是安全的，长期服用他汀类药物也有助于预防心脏病、中风，甚至减低死亡率。现在黄奶奶有另一个疑问：我吃好多药，有时候会便秘，粪便也很硬，这是正常的吗？还是有铁质是造成这类问题呢？铁质是要空腹吃，还是要吃饱之后吃呢？ 铁质帮助人体制造红血球，铁质空腹吸收是最好的，但如果胃不舒服，可以饭后吃。维生素 C 也可以稍微增加它的吸收，但咖啡、牛奶、钙片、胃药片会减少它的吸收。黑色便秘粪便也是正常的，若便秘可以多喝水，多吃纤维。黄奶奶最近有便秘的症状，接下来我们来探讨便秘是药物造成的吗？确实，有些药物容易造成便秘，例如一些抗抑郁药、镇定剂、利尿剂、高血压、铁质、制酸剂以及含有吗啡成分的止痛药等，都会造成便秘。治疗便秘的重点是多喝水、多吃纤维、增加运动、规律便秘习惯。每天早餐后15至20分钟是最好如厕时间。有便秘不要忍住，上厕所也不要用力过度或者如厕太久。温和的泻剂，例如乳果糖，可以长期使用，因为它有助于软化粪便。但我们需要避免长期依赖刺激性的泻剂，例如番泻叶或者叫 Senna。那咖啡可以配药吗？许多人喜欢喝咖啡，但咖啡和药物之间也有交互作用。我们来看看咖啡是如何影响药物的。咖啡因会刺激神经系统，虽然大部分人每天都喝4到5杯咖啡，普遍认为是安全的，但咖啡与某些药物同时服用可能会降低药效。例如，咖啡会降低甲状腺刺激药物、某些抗生素、维生素 B 以及骨骼疏松症的药物的吸收。这些药物应该用白开水服用。咖啡因还有利尿作用，会导致身体流失更多水分。一些镇静、催眠的安眠药也要避免与咖啡同服，因为咖啡因能引起神经中的兴奋，会加重失眠症的症状。为了安全起见，除非医疗人员另有建议，否则最好避免药物与咖啡一起服用。接下来我们看看最后一个例子，陈叔叔57岁。陈叔叔现在在服用抗血凝剂、抗抑郁症、降血糖和止痛药。他有一个疑虑，我现在在吃抗凝血药华法林，在饮食方面需要注意什么呢？这个抗凝血剂是防止动脉、静脉或者心脏内血形成的药物，同时还能预防现有的血块扩大。华法林的功效取决于人体内的维生素 K 和所食用的食物。大量的维他命 K 的食物会增加血栓成型，而低维生素 K 饮食会导致血炎，减低抗凝血作用。所以林叔叔需尽量摄取同等分量的维生素 K 食物，确保健康及均衡的饮食。许多草药和保健品也会影响华法林的功效，例如降低华法林的效果和 INR 指数的包括 coenzyme Q10、圣约翰草、人参、绿色蔬菜，而增加出血和 INR 的包括当归、银杏和我们常见的 glucosamine 加 chondroitin。跟大蒜和大量的生姜，所以不可以同时服用中药和西药，除非先咨询医生。若出现无故淤青、牙龈出血、黑便、血尿等情况，一定要立即求医。再来，林叔叔和陈叔叔每个星期都会在家楼下喝咖啡，聚会2到3次。 每次聚会都会喝啤酒，那啤酒和他们的药物有冲突吗？这是林叔叔现在吃的药物，和陈叔叔所吃的药物。他们的一些药物和酒精会起相互作用，这是因为酒精会以药物增代谢途径，酒精也可能是使药物增加或延长，药物也可能让酒精无法正常代谢，所以酒精和药物是有交互作用的。由于酒精和药物都竞争着一些相同的代谢酶，因此人体的药物剂量和酒精浓度必定会受到影响。酒精会减缓一些药物的代谢过程，使其在体内聚并增加其作用，从而增加副作用或毒性。同样的，有些药物可以阻止酒精分解，使酒精积聚在血液中，引发恶心、呕吐、头痛或面色潮红等不良反应。生理状态下，肝脏会释放葡萄糖来维持血糖水平，但饮酒会使肝脏忙于分解酒精，不能释放足够的葡萄糖入血，因此空腹饮酒会导致血糖下降。肝脏完全分解一份酒精通常需要1到1.5个小时，在此服用低血糖的风险，饮酒越多，低血糖的风险越大。此外，时常饮酒会增加甘油三酯的水平，导致血脂高，患心脏病的风险也会增加。此外，酒精也会增加内出血且血液无法凝固的风险，导致华法林剂量不稳定。我们常见的 Panadol 或者叫 Paracetamol 与酒精也在争夺同一代谢酶。饮酒过多会增加这些酶的活性，使 Paracetamol 分解为有毒物质，久而久之会导致严重的肝受损，甚至肝衰竭。因此，饮酒时需避免服用 Panadol 或者 Paracetamol，以保护肝脏和全身健康。此外，酒精也会增加抗抑郁药的副作用，影响判断力和协调性。在结束之前，给大家几个重点：第一，不要分享自己的药物给别人；第二，尽量不要混合使用中药和西药；第三，服药最好用白开水，不要用咖啡、茶、牛奶或汽水代替；第四，酒精会增强许多药物的副作用，要尽量减少饮酒。最后，如果对药物不清楚，随时咨询医生或药剂师。谢谢。大家有什么问题吗？
Hi, I think some might be asking whether can they have the slides. Is it
Sure.
possible?
Yeah.
Okay, okay. Then you can email to me lah. So I really leave down my email address there. Those who are interested can email me to request.
Sure.
Then Lo Chi Fan actually type in Chinese 啊，我不怎么会读诶。Sorry, Lo Chi Fan，你是指什么？
因为如果是我们要你讲中文的时候，我们 record 你是从开始放那个幻灯片，那我们就是没有开头一半，这样变成那个 record 就不完整。And then
关系不会，
到一半我就想到，咦，原来丁老师没有 record
Sorry，
没事，
Auntie
我可以做
logo
成一个 video，然后 send 给你们。
哦，actually 没事。我想问 Radima CC 哦，你们很像有那个YouTube 是吗？Radima CC 的人，OK，不然讲什么？Radima CC reply 我有什
这
么？你们在
完整的
YouTube 有 right？
他说下个礼拜会放在那个 YouTube，
啊，
哎，
好，谢谢谢谢。我会讲话，不会读。
我觉得，这样我们的 YouTube 应该是要怎样，就是找到这一个所谓视频，要打些什么英文字呢？谢谢。
嗯，Radima CC，你可以 reply 吗？这个
不过其实我也很谢谢今天的演讲者，因为现在很多医院的讲座都没有中文版，都是英文的，所以有中文版，我们听起来就比较讲讲
嗯
知道要自己要注意一下那种这样啊，
嗯，
谢谢你
很
啊。
好。
可
哦
以，我也可
，OK，Radima
以做成一个video 或者影片，然后再发给大家。
Okay, they sound excellent.
呀，还
嗯，
有Radima
Excellent.
CC 说他们会 WhatsApp 你那个 YouTube 的那个 link 啊。嗯，
我好像没有，我好像不是他们的 WhatsApp link 的人。
哦，不是哈。嗯
哎，是啊，所以
，maybe
别看 YouTube 而已，就是咯。
那你找，可能你找 Silver Clip，你看有没有？
那 Silver Click 吗？他在里面吗？怎么问里面他没有？
那我就
花什么钱都有的。
我就在那个 YouTube 那边找一下啦，谢谢谢谢。
Yeah。So
Hi,
and
Can I
also
ask a question?
你没有，你当然你看得到，你那里会进去。
Hello.
来，Yes，
Can I ask
continue。
a question? Just now the presenter, the lady, she says that cannot eat medicine with coffee or that. Yes, we know. But if let's say we drink coffee 2 hours later, before medication or after medication, is it okay?
Depending on what medication you are taking now, what are the long-term medication you are
But the
taking now?
long term is as usual for seniors is always your BP, your BP, your
Mhm.
losartan and your, another one, your bisoprolol, and the other one is the amlodipine.
Amlodipine
Ah,
IP.
So this
That is totally fine.
can drink coffee 2 hours later lah and all that.
That is totally fine.
Okay, but must not drink within the 2 hours, what you're saying, lah, right? Must be after, before or pre or after. So it's okay, right?
Yeah, that's right. But depending on what long-term medication that you are taking, some medication may interact, some medication will not. From what you mentioned just now, those medication does not have any interactions lah, so you may continue to take those as prescribed.
No, I mean with the coffee lah, can.
Can.
Coffee. Okay, you were saying about glucosamine, yeah? Glucosamine, you said cannot take with coffee within the same timing. Why cannot lah?
Glucosamine with warfarin.
Well, warfarin, but with glucosamine on its own, you still can drink coffee after that, right? No need the 2
Yes,
hours
that's right.
interval.
That's
Okay,
right.
can.
Because
Thank you.
warfarin actually interacts with a lot of medications and a lot of supplements. So for
Warfarin is
those
a blood,
patients,
it's a blood thinner, right? Warfarin is a blood thinner. But let's
that's
say you
right.
don't take warfarin, you take another type of blood thinner like clopidogrel, all that. Does it interfere?
No, that is fine. Only
okay.
warfarin.
Okay.
Some special medications.
Thank you. Thank you.
呀，
我想问一下哈，Hello，
可以来
我想问一下，如果我平时喝茶哈，当然我要吃药的话，这个中国茶会不会不适合哈？
您现在在吃什么长期药物呢？
有胆固醇，还有那个糖尿病的，还有甲状腺的。
甲状腺啊，你平时喝茶是有加奶的那种吗？
没有，我是喝中国茶。
中国茶而已啦，没有奶啦，没有奶制品那些。
没有。中国茶，喝中国茶，但是早餐我喝中国茶，但是之后吃完了早餐我吃药， 我有时候在想，中国茶跟药会不会冲突？
除了你喝中国茶之外，你的早餐还包括什么呢？
有时候是面包或者那些松桂啊这些的。
OK，是不是没有奶制品那些啦？因为刚刚您提到那个甲状腺的药物可能会跟奶制品会有冲突。
奶制品？
奶制品包括牛奶、yogurt、cheese 那些。
哦
需要各
哦
开至少4个小时。
哦，没有没有没有，
好像你平时如果喝 Milo 啊，放 Milo 粉啊，3合1包装的那些，其实也是有奶制品在里面。
哦。
嗯，
所以只要有奶制品的话，就那个
需要隔
甲状
开。
腺的是吧？甲状腺
对，
的，
对，您刚刚有提到那个甲状腺的药，对吗？
对对对，
因为它
所以
的这个药呢，甲状腺的药需要很早很早一起身就吃。您现在是早上起来就吃吗？
我我是吃饱后才吃嘞，
吃饱后才吃啊？您的
我
甲
不懂应该是
状腺的药是 levothyroxine 吗？
我的甲状腺啊，
啊，
我看一下其实我都不懂这些药名，等一下我看一下啊，
好的。
但是我是各一天吃一次，各一天吃一次，甲状腺，诶呀，那个叫他妈 zona，
帕比马说，那个没关系，那个是减低甲状腺的。如果是那个 levothyroxine 增加那个那个 thyroxine level 的那个呢，就跟奶制品有冲突。您现在吃的这个是跟其他的没有冲突的，
所以如果他喝买楼有奶制品了哈，也是
那个也
OK。
OK。
哦，
对，
这样我这个是要在饭前吃还是饭后吃啊？
你平时是饭后吃对吗？
对，我平时
那继续饭后吃可以，除非
OK，
是另外一种甲状腺的药，比较常见的是那个增加那个 thyroxine level，那个就需要饭前。您这个还 OK，
增加的 rosin 是什么？增加什么意思？那个是增加什么东西？
增加，因为您现在是那个甲状腺的那个药是降低的那个，不是那个增加的。
OK，
对，
所以我喝中国茶了，有时候因为
可以，
我就
没问题。
是不要喝咖啡咯，不要喝咖啡茶，所以我就喝中国茶。那喝中国茶了之后，早餐吃那些东西跟中国茶之后，
没问题。
我就吃全部的药了咯。所以我就在想会不会影响好像人家说中药跟西药不要同个时候吃，所以我这个是中国茶，我就担心不懂会不会影响。所以
中国茶是没问题。
OK， 任何中国茶都可以哈，任何
对，
因为中国茶很多种啊，
对，
所以任何的中国茶都可以了。
对
，OK， 好，谢谢。
不客气。
Can I chat with you? I'm
嗯
Peggy. And then
，Hello。
hello. I cannot take coffee and tea because I have insomnia. So I cannot sleep if I take coffee and tea. So every day I take Milo. But now it seems Milo and milk I also cannot take it. So what can I take? What beverage can I take in the morning?
Are you Peggy Low? I
Yes.
saw your message in your chat group.
Message.
So you're
Yes.
taking aspirin, atorvastatin, and atenolol, right?
Yes. And
Yeah,
then
there's
actually I'm
and
taking
atenolol.
16 tablets every day. A lot.
Ah, right. I don't see any interactions from the medication that you are taking now, because you are not taking coffee and tea due to the insomnia issue. So you can continue to take Milo as per usual. No issue.
Oh, no
Mm.
issue with my
Yeah, and the
okay, good.
statin that you are taking now can be taken in the morning because it's a newer statin. So it's actually stay in your body for longer time. Although our body actually produce more cholesterol at night, but this newer statin can be taken in the morning.
Yeah.
Not like others,
Thanks.
over statin like simvastatin must be taken at night.
Okay, sorry. On the topic of the atorvastatin, taking at night, I take immediately after dinner, not at bedtime. Is it okay? Because that's why you mentioned must be at bedtime. After dinner, I
That's
swallow
fine.
it already. Can? Is that still
Can.
effective?
Yes. So
Or more
statin,
effective at daytime?
so atorvastatin, right? Some doctors actually prescribe in the morning because it actually improves the adherence of the medication. But it is fine to take any time of the day.
Oh, but
But
they
make
told me
sure
to
just
take
one
night
tablet
time.
per day.
Oh.
At
But the
night is fine.
prescription was
Morning
specifically at
also
night.
fine.
Okay,
Yes.
can. Okay, thank you.
Atorvastatin, morning or nighttime,
Okay.
both is okay, but make sure just one tablet at the same time every day.
Okay, thank you.
Thanks.
No problem. And also we have another inquiry. Any conflict between omega supplements against metformin, atorvastatin, lisinopril, or aspirin? Just to check whether this omega is it for like a daily supplement?
Hang on. So it's me. Actually, it's given to me by my junior as a supplement. So it's
Okay.
quite a big box. It's quite a big bottle. So I wasn't sure whether should I consume it. I understand that the omega-369 is meant for blood vessels to be more healthy. And I'm
All right.
actually a stroke patient, so they think that it might be good for me. But before I take, I thought I want to double check whether it is suitable for me to take it.
Okay. So this omega contains omega-3, omega-6, and omega-9.
That's why they clean flaxseed oil.
Right. And you started already or haven't? Haven't, right?
No, I have not. I'm just being careful about it.
I see. So looking at your chronic medication, that includes metformin, atorvastatin,
Yep.
lisinopril, and
Yes.
aspirin.
Yes.
Any other medication that you actually purchase off the shelf or any supplements that you're taking now? Other supplement?
No, never.
Any
Nothing.
Chinese traditional medicine?
I don't. Only there's a ginseng pill which I don't take for a long time already.
Ginseng pill, but stop for a while already lah.
Yeah. Yep.
Any medication that you prescribe off the shelf? No, huh?
Never.
Okay, looking at your medication list, right? There's no contraindication you may take, but make sure the dosage, right? You follow the supplement dosage, which means usually the omega will, for health supplement, right? They actually just allow one tablet a day lah.
This one they prescribe twice a day.
Okay, twice a day, yeah. What's
Yeah.
the active, the amount stated there? How many mg?
1,005.
1,005. My suggestion, maybe you try one capsule first. If everything is okay, you just maintain one tablet per day. Yeah.
This is where the trick part is. What's mean everything is okay? How do you know it's okay? Sometimes can be silent.
Yeah, so after you administer, if you never notice any rashes or any swollen eye, swollen lip, difficulty in breathing, those are common allergic reaction. If you don't have those, you may continue to take. However, if you develop any rashes, swollen eye, swollen lip, difficulty in breathing, you might need to stop and see doctor lah.
For my case, I'm allergic to amoxicillin.
Amoxicillin.
Yep.
No, this supplement doesn't contain any amoxicillin inside. Amoxicillin is an antibiotic. So if you go to GP polyclinic, if they prescribe you with any antibiotics, do let them know that you're allergic to amoxicillin because some of the combination of the antibiotics, for example, like augmentin, it may contains amoxicillin as well.
Yeah, I know. I pay heavy price for it. Hospitalized for it.
Yeah, so must be very careful, especially those antibiotics that come in combination and you are not sure whether the name may sound different, like it's not amoxicillin, it's called augmentin, but actually contains amoxicillin inside.
Okay. Good.
Yeah.
Thank you.
No problem. There's another inquiry. What is considered large amount of ginger and garlic that can cause risk of bleeding if taking blood thinner? So this blood thinner that I'm talking about, it's warfarin. It's not really a common blood thinner prescribed to the public. So if you're taking like aspirin and all that, is fine. So warfarin is a special blood thinner. They need strict diet, proper diet consideration, like amount of vitamin K that you take per day, veggie that you take. So need to be consistent in terms of your diet. So you cannot like one day you take garlic a lot, then next day you never take garlic, then the subsequent week you take a lot of garlic again. That will cause your INR, which is an indicator of warfarin, right, causing fluctuation while you're taking warfarin. So it's a bit hard for us to actually adjust your dosage. Yes. So this warfarin is not a commonly prescribed blood thinner. The most commonly prescribed one is aspirin, like what y'all mentioned just now. I see most of the inquiry got aspirin inside lah. So no worry about aspirin, because aspirin doesn't interact with vitamin K or vitamin K supplements. So no worry about that.
All right, thank you.
Thank you.
The next
yeah,
question.
Hello.
The next question that I asked.
Hi.
Yeah,刚才我不是说我早上喝茶，我还有吃一个是那个名字叫 Sarah 豆啊，Sarah 豆的，这个也是没有影响喝茶。
你再讲多一次，Sarato 怎样 spell 啊
？Saranto， Saranto 啊，Saranto 100。
那个血压药对吗？
那个是血压，可是医生是跟我讲保护我的 kidney， 他没有跟我讲是血
或血压，因为这个药有很多不同的作用啦。是没有关系的，你还是可以继续喝你的中国茶。
可是我的血压没有高嘞，所以我就说说这个是，他是跟我讲吃这个是保护我的肾。
它有2个功能，一个是保护肾，一个是降血压。
但是我血压没有高，所以吃进去就是变成保护肾啊。
对，
如果血压高的话，这个也是就等于这个也就是降低血压是吗？
这个药呢有2个功效，第一个是保护肾，第二个是用于高血压。对，您的血压在家里大概量的是多少呢？
通常130多吧。
130啦。好，你不会有头晕那些哈？
没有，我没有高血压。
好，那这样就没有问题，您需要继续吃这个药。
OK， 但是这个如果我喝中国茶的也是没有影响哦。
没有影响。
还有他有给我 calcium 啊，那个等一下这个 vitamin D 啊，这些也是没有影响哦。
calcium 跟维他命 D 对吗？不是 B 哈 ，D 对吗
？D 啊，那个叫做不懂叫什么
cholecalciferol。对，那个维他命 D 跟 calcium 一起吃的话呢，那个维他命 D 会增加 calcium 的吸收。
但是我是说我喝茶在吃这个，没有
关系。
OK， 我就在想，OK， 另外一个胆固醇，还有另外
没问题。
calcium 的也是3高 D， 那个也是 OK 啦。
对
，3高 D 那个是
对，3高是一个 combination。对 ，calcium 加维他命 D， 那个 combination 是因为需要那个维他命 D 来增加 calcium 的吸收。
这样这些好像他给我的calcium跟那个 D 啊，他是说下午吃，其实早上也是可以一起吃是吗？因为早上
你早上是不是吃很多其他的药啊？所以医生讲你中午吃比较好。
早上我吃
跟其他的药隔开。
thyroid 的，还有 blood sugar，还有胆固醇，还有那个kidney 的 loss 就4种。那但是 thyroid 的我是 alternate 啦。
我个人觉得啦，
啊，他才
您
说你
是因为可
下午吃
能早上有比较多的药物，所以医生是觉得您中午吃会比较好。
啊。如果我中午没有吃，拖到晚上吃也是 OK 啦。
呃，晚上吃啊，如果你忘记的话是可以晚上啦，但是我的建议还是中午每天。你是每天吃一粒吗？还是
那个好像跟
对维他
呀
命 D
是每天
一粒？
吃一粒啊，但是有时候我
饭前还
懒得吃
是饭后吃啊？
啊。
饭前还是饭后吃呢？
应该不懂我，因为我全部把我要吃的药全部放在一个纸袋里，应该我通常是饭后吃吧。
对，饭后吃是对的，所以你每
啊
个中午饭后吃没问题，你可以继续
啊，
这个 routine。对，
如果那个我的 blood sugar 跟thyroid 这些还有 kidney 啊，还有胆固醇，如果我早餐很迟才吃，因为然后我拖到11点多12点才来吃，我这个早上该吃的药，应该没问题吧？
没问题，加减几个小时其实还是 OK 的。
哦，OK，因为我
你不要等到
还没有吃
晚上
早餐嘛，
你不要等到晚上了，你才记得，诶，我早上的药没吃，然后你晚上吃，等下第二天早上又吃，这样就不对。
就太
如果你
时间太接近啊，
对，如果你
至少有
晚上才
半天哦。
想起，对你晚上才想起哦，你就不要吃了，你等第二天早上吃。
OK，因为有时
嗯，
候我的早餐会很迟吃，大概10点多11点，所
没
以
问题的。
我就想，哎，这样吃，然后我吃药不懂会不会怎么样？就
对，
是这
加
个药应该
减几个
早上吃。
小时其实是 OK。
OK，好，
嗯
这样我就放心了，谢谢。
好，没问题。
Can I check with you? Recently I'm using this 22 greens as
Mm.
beverage. Is it okay? 22 greens.
May I see the ingredients, please? Sorry.
Yeah. Can see
Uh,
a lot, a
cannot
lot.
see very
Yeah,
clearly. What are the ingredients inside? Sorry.
a lot. The ingredients they have what organic what millet. Then cause they actually have I'm buying this one got berries, all the berries. Then got
Berries.
many types.
Okay.
Yeah,
Okay.
they say it's good for the eyes. And then a
Some
lot of
lutein inside
others.
also lah.
Yeah. Because when they do types of grains,
I see. Other than aspirin, atorvastatin, and atenolol, you are not on anything else, right?
and tenderloin.
Yeah,
I'm
and then
using it tenderloin.
the law aspirin and atorvastatin, right?
A lot. The hospital actually give me 10 tablets. And then I also go and buy some vitamins outside because I got some like I have side effects, some side effects. So like hospital give me this some vitamins I cannot take. So like those vitamins they actually
Some vitamins that you purchase off the shelf, and some you get it from hospital, is it?
yes.
Okay.
Because
If that's the case, right?
some vitamins like is actually got fish inside, and then like seafood I cannot take. So I got to go and buy outside with the vegetarian type of
You're allergic to seafood.
yes.
See. Okay. Do you have the full list of your medications? Because from what I see from the chat, right, you only put in
Because a
aspirin,
lot yeah.
atorvastatin, and atenolol. Yeah.
Oh, I go and take.
Okay.
Wow, they must tell them what the vitamin you eat. What the whole list of medication.
So usually if you see like a very long list of medication, if you are not sure whether it interacts with your daily supplements or anything that you purchase off the shelves, when you are collecting the medication, always check with the pharmacist or you can check with your doctors as well whether you are suitable to take this supplement. Yeah. Because sometimes if the list is very long, right, it may cause some malinteraction here and there, but you're unsure. So it's always good to check with your pharmacist or doctors lah.
I'm buying two types of glucosamine
Okay.
from
Yeah.
outside, but this one is vegetarian. So vegetarian because they
Yeah,
say can
correct.
take 1,500. So I actually taking two types of two brands. But anyway, tomorrow I'm collecting a new medicine from my GP, and then I
Okay.
will check with him. I will bring all the medicine over, and then check
Correct.
with him whether I
Correct.
can take all those
Mm.
medicine, can mix or
Correct.
not.
You may bring all the medication, just one strip will do, and you let your doctor know these are the medication that I'm taking. And understand that you purchase glucosamine, the veggie cap outside, right? The reason why is because I think current brand in hospital actually contains like something similar to seafood lah. So those patients who are allergic to seashells and all that, right, might not be suitable. You might need to purchase outside or get the veggie cap. Yeah.
Yes.
Any other inquiries from the ground?
Thank you.
I take glucosamine, calcium, D3, B12 every morning. Can this goes with oat and milk powder? That is fine.
So, is there any other questions from the rest of you? 还有没有问题？因为时间到了3:11了，so maybe 我让 Madeline 关这个这个 talk 可以吗？Madeline？
好了，现在 so now since it's over 3 already, so we will end the session. Thank you so much, Miss Charlene, for sharing.
Yeah, maybe to add on 如果你们有这种药物的问题还是什么的，我们有那个社区护士在你们的那些老人什么
那
AAC
些AAC 乐龄中心，你们看有没有那些community health post？
对，但你可以去找我们的护
你
士。
可以去找我们的护士来问一下，如果你有什么对你的药物有什么疑问的话。
好，OK，可以哈。
Okay, thank you.
All right,
Thank you
thank
very
you.
Thank you.
谢谢，拜拜。
谢谢，拜拜。
有
應該有。
等我。
唔係呢個，唔係用呢個，唔係
唔係個
365，normal 啊。好耐 Mr. Singh 冇俾呢個。
好啦。
Hello, I have long time I didn't join. How do I scan this QR code? I have forgotten how to do. No, the
Google Lens.
Google Lens. So must take a shot and go Google Lens and do, is it?
Yes.
Okay, I try. Thank you.
不过
hearing
现
from
在
you.
应该也是 scan 不到了。它一出现的时候 scan 就过，有一个 pass， 现在是交叉了。
什么事？
它时间很
没做了，忘记了。
你就算记得，现在也是 scan 不到东西。
为什么？
因为他们现在都是很短的时间，
一下子就关了。
放出来大概可能5分钟左右你不在很快的时间 scan 你就是拿不到，看不到那个分数。
我没事，我问你再快
点让你看到我即刻 scan 它啦。OK，祝你好运。
好，谢谢，拜拜。
今天的 QR code 好像不对嘞，打叉的。
他一出来我
要
scan
feedback 咯，要 feedback 给主办当局哦。
我很多次，他们已经很多次都要很快，第一时间 scan，然后你过多1-2分钟，他可能就没料了。
哦，那你要通知 Ready Mas 哦。
我只认识一个慧琪，可是慧琪今天没班，没边。
要 feedback，不然的话每个人没有讲哦，他们不知道。
对，现在要紧张一点这样哦。啊，改次我慧琪我跟他讲一下。好，
谢谢，拜拜，大家祝福，我要离开了，拜拜。